Hey everyone, it's Dr. Ellie. I'm here again with my podcast, I Heal Kids. And if you don't know me already, I'm also the founder of Middle Path Integrated Pediatrics, and this is my office. And I'm located in Asheville, North Carolina. So if you live in and around Asheville, North Carolina, and you need a holistic pediatrician for kiddos ages 0 to 21, then I am your gal. And if you need functional medicine help for ages 2 to 102, I'm your gal for that as well. And today we're going to go ahead and talk about fever. So I get questions all the time about fever. I mean, just the other day, someone was asking me about what is the best way to take a temperature. First of all, I just want to say that fevers are very kind of misunderstood. And there's a lot of fever phobia in our culture. We're just terrified of the fever itself. And the fever itself is actually a natural response, and it's a healthy response of the body. And it just kind of helps us fight off infection. Now, of course, there's times to worry and times not to. And I'm going to cover all of that today, including what is a fever, and then holistic and conventional approaches to managing a fever if you need to. All right, that said, let's jump in. So what in the world is a fever, first of all? So our normal body temperature is about 98.6 degrees Fahrenheit or 37 Celsius. Of course, that can kind of vary a little bit, depending on how you're born and your genetics and all of that. But typically, a fever is 100.4 or higher Fahrenheit or 38 centigrade if you are taking the temperature rectally, through the ear, or a forehead thermometer. Now, if you're doing it orally, it would be 100 degrees or higher. And if you're taking it under the arm, you really do need to know that a fever is 99. So you would add a degree to think about, hey, it's actually 100 and that's a fever. In kiddos under 3 months of age, I do recommend that you go ahead and take that rectal temperature. And your pediatrician can show you how to do that. I can't really show you on the podcast, but that's because it's one of the more accurate ways to take a temperature. And if your kiddo is that little and they have a fever, that tends to make people worry a lot more. And so you want to be sure if it's a fever or not. So 100.4, or was it really just 99.6 or something like that, where it wouldn't really trigger such a, strong response from the medical community, because sometimes that can lead to people going down a rabbit hole, especially in the emergency room where, they might say, well, oh my gosh, on top of needing an RSV test and a flu test and, chest x-ray, we also should do a spinal tap and all of this stuff. And so you just really want to be clear if it was a fever or not. So I tell my parents, if you feel your baby hot, just go ahead and check they're not just over bundled. Sometimes it's just so easy to do. They end up with 3 or 4 layers and they're just kind of sweaty and hot. Just go ahead and unbundle them, let them kind of just air out for a few minutes, and then go ahead and take that rectal temperature. And, if it is 100.4 or higher in a young infant, then you do want to seek care right away. And then for older kids, depending on what's going on that we'll talk about later, you may want to reach out to your pediatrician. Okay, so like we talked about before, fever is a natural defense mechanism. So basically, it's just a way that the body responds to infection. So if you have a virus or bacteria, then your immune system is hey, we need to basically kill off this invader. And how are we going to do that? Well, what happens is your immune system, all of those immune cells in your body, basically send a signal to your brain or your hypothalamus, which is a part of the brain that regulates your body temperature, and says, hey, can you please try and burn off this germ? So the immune system is hey, brain, please turn up the temperature so that those germs, basically die. And that helps us fight off infection. And that's because, the higher temperature basically creates an unfavorable environment and it slows the growth and spread. But also, it's kind of an interesting thing where the immune system is talking to the brain and then the temperature is talking to the immune system. So the fever can actually increase the activity of the white blood cells, which are those cells in our body that fight off infection. And so that will help boost that as well. Fever also, it can promote healing. So it enhances blood circulation. It helps immune cells kind of reach where they need to go more efficiently and more quickly. It's good to know that usually, a fever is not in and of itself dangerous. It's just a sign that the immune system is saying, hey, I'm doing my job, I'm fighting something. So mild to moderate fevers are just a sign that the body is actively fighting the illness and they're supporting the natural healing process. So, when do you want to do something about a fever? Like when should you, reach for something to bring the fever down? Well, sometimes it can lead to complications like febrile seizure, but that's not easy to treat. You can't really prevent a fever seizure if it's going to happen. And the reason for that is it's just because fever seizures are not triggered so much by like the height of the temperature, it's triggered by how fast your body gets the temperature. So it's really hard to prevent because if you get a really quick spike, you're not likely to know that you needed to have treated that because it's happened so fast. And then, something like a seizure can happen, which of course can be really scary. And we'll definitely talk about that a little bit later on. So, things that you would want to treat would be, is your baby uncomfortable? Is your child uncomfortable? They are not able to drink well. They seem kind of tired. They look like can't really like interact with you well. But especially if they're getting dehydrated, they're not having good urine output, like that's a time to go ahead and treat the fever, so they can be comfortable and they can kind of get back to themselves and drink more regularly and just feel a little bit better in general. So, what are some kind of warning signs? Well, we already talked about, some red flags that require immediate medical attention. So, if you do have an infant 3 months and under, and they do have a temperature of 100.4 or higher, and you took a temperature rectally and you let them kind of cool down and unbundle and all of that, and they are having that high temperature, you do want to go ahead and seek care right away. So if you can't get in with your pediatrician the same day, that's when you would want to go ahead and see the urgent care or even sometimes the emergency room. So the reason for that is that infants, obviously they're infants, so they're a little bit more delicate. And then also there are some infections that they can get from the birthing process that can be quite serious. We just want to make sure that the source of the fever isn't something dangerous, like one of those bad infections. You just want to go to the doctor and make sure, it's just a cold. Let's learn how to treat that and kind of move on. But you don't want to just stay at home and kind of wonder, like, why do they have this fever? If you have a child that has a fever more than 5 days, that's a warning sign. It might be that it's no longer a virus that's causing it. It might not be that head cold anymore. Maybe it's moved into something more serious. God forbid, something like Kawasaki syndrome, one of these like more dire circumstances or like a bacterial infection, something like that, then we'll want to go ahead and make sure that we're getting treatment for that. Again, dehydration, if you are seeing that your child or baby is having like really dry lips, and more so it's like the inside of the lips, the inside of the mouth, not having like a wet tongue. When they cry, they're not having good tears, or maybe their diapers are just not as wet as they used to be. That can all be a sign of dehydration. So you definitely want to reach out to your pediatrician or urgent care or something like that to make sure, that they don't need fluids or like further intervention. Lethargy. Okay, so lethargy is one of those kind of terms that it's used super medically, and then I think it's like confusing for people, understandably. So when we're talking about like medical lethargy, like if we're saying like, oh, is your child lethargic? Of course they're going to be tired because they're sick and all of that. But what it really means is, can they wake up to interact with you or play? So if they're just kind of staring off into space, or you're trying to get their attention and you're like, hey, sweetie, like, can you wake up and drink something? And they're just out of it and they seem kind of floppy, like that's like an emergency. Go to the ER right away because that is not okay. Difficulty breathing. Obviously, if your child is having trouble breathing, God forbid, turning blue, struggling to breathe, please go to the emergency room. That is not a good sign. Okay, rashes that don't fade under pressure. So this is something that's like your kiddo has a rash and you push with your finger on the rash and the rash was red and it stays red. That could be a concern. So sometimes it's hard to tell though, because a lot of kiddos get fevers, like viral rashes that happen after a fever, and those aren't really severe at all. And that would be as if you have a red rash and you push it and it turns white really quickly, or kind of blanches, like turns to a lighter color. And then it comes back to like that red color again, then that would be something that could be possibly more serious. So definitely reach out to your pediatrician or seek, more urgent care if you're seeing anything like that. Fever seizures, of course, you're going to call 911 because they're terrifying. I mean, they're absolutely terrifying to watch. I will say that they're not usually anything to worry about long term, and I'll talk about more about that a little bit later. Okay, things that you like don't need to worry about. So if your kiddo's kind of has a little bit of a mild fever, but they're kind of active, they're still a little bit playful, the fever is coming and going, you're able to get them to drink and to rest, and it seems to be responding. That's not necessarily something you need to panic about, especially if they have like a little head cold or something and you know where that temperature is coming from. That being said, definitely call your doctor if, God forbid, they're not drinking or their activity level is dropping, they're not urinating well, their color changes, they're blue or they're pale, they're not able to maintain like kind of their, I wouldn't say normal, but like close to normal kind of selves, so if they're starting to look kind of crummy, then you want to go ahead and bring them in. Another thing would be like, if your kiddo has like a lot of pain, like specific pain complaints that you're like, that's kind of different, like why is he complaining that her stomach hurts? Or why is she saying like it hurts to pee? They have like a cut that got infected and that hurts. If something is specifically a pain complaint, then you definitely want to look in and see why do they have a fever plus the pain as well. Another serious sign would be if your child has like a very bad headache, or if they're having like neck pain with significant neck stiffness. That can be a sign of something severe like meningitis. And meningitis is basically just inflammation of the brain and the meninges, which is like the coating for the spinal cord. And that's very severe. So if your child's just like extreme headache that's not going away and their neck is hurting and their neck is stiff, like you do need to go to the emergency room for something like that. Quick myth busters here. So one myth is that fever 104 or higher is dangerous and can cause brain damage. So actually, not true. So this temperature doesn't mean that it's going to cause brain damage. It's really above 108 that can cause brain damage. And that is extremely rare for kiddos to have 108 or higher. And usually it's in really unfortunate situations where like a child was left in a hot closed car in hot weather. That's usually when the body will overheat. Another myth, anyone can have a seizure that's triggered by fever. Not true. So only about 4% of kids can have a seizure with a fever. So it's not every kid that's going to happen to. And another myth would be like seizures with fever are really, really, harmful in the long term. The truth is they are awfully terrifying to watch. And I hope that no one's kid ever has one. But typically they stop within 5 minutes, and typically they're not going to cause any permanent harm. And it wouldn't like increase, a risk of like speech delay or learning issues, or even having like seizures without a fever or anything like that. It's just not related. So just know that, yes, it can happen, but it's a very small amount of people that it does happen to. And kids tend to grow out of that. Even if they've had that, like a seizure with a fever and they're prone to them, they tend to grow out of it by like age 5. So it is something that generally goes away, and it doesn't mean that you're going to have like, epilepsy or like seizures otherwise. All right. Again, like if it happens, you're going to want to call 911 just to make sure that the seizure does stop in 5 minutes, number one, and to make sure they're not having a seizure for a different reason. Like God forbid, now they've got meningitis and that's why they have a seizure. So that would need treatment. Okay. So you do want to just make sure you seek care. Okay. Holistic treatments and comfort measures. All right. So let's say your kiddo's like, they don't need to go to the emergency room, but they're just a little bit kind of punky. They don't feel very well. They're not drinking as much as you want. What can you kind of do? Well, one, you can offer hydration. So depending on the age, you can do breast milk or formula in the infant age range. And then if they're an older kiddo, you can offer a little bit of water. Obviously, in children who are, much older, you want to kind of push those electrolytes. That doesn't mean go out and buy, something with a bunch of junk in it and artificial flavors and food dyes and all of that. We want to avoid anything like that. but you do want to make sure that they have a drink that has some kind of electrolyte in it. So you could do like coconut milk with a pinch of salt, or you could make one of those homemade electrolyte drinks at home. And they're all over the internet. You can find out how to do them with just salt and water and a little bit of sugar. Obviously, have them rest. So we want the body to kind of relax, enjoy like quiet activities, let the body release the body heat. So just making sure, they're not like shivering. So they're like putting like 10 blankets on, but they've got a fever. And so those blankets are going to keep the heat in and raise their body temperature, which is counterproductive. So we just want to make sure that they're airing themselves out. Another thing you can do is like a lukewarm compress or even a wet sock treatment, which sounds a little crazy, I know, but you can definitely try it. And what that means is you're just either getting like a wet washcloth and kind of dabbing their body, or you're just making a lukewarm bath. Or, some people will actually just kind of dip socks in like lukewarm water and have their kiddo wear those, and that can kind of cool the body as well. I will say one thing to avoid would be a cold bath. So we're not looking for like ice cold bath, because that can be really dangerous and cause a lot of like issues in the body, especially like heart stuff. So we just want to avoid, shocking the body with like ice cold water, but lukewarm is perfectly fine to kind of help make kiddos more comfortable when they have a fever. Herbal tea, you may want to make it a cool tea rather than a hot tea. But if you're doing like a chamomile or a ginger, go ahead and brew it, let it cool down, add a little bit of ice. You may want to add a little honey, to make it a little bit more palatable for kids, and have them kind of sip that. And that's very calming. It's very soothing on the body. A lot of medicinal herbal effects with those. And also, it's hydrating, right? So if we can do a little bit of herbal tea, all the better. For older kiddos, if you are doing like a lukewarm bath for a fever, you can do a little Epsom salt as well in the bath, and that can kind of help relax the muscles, and it can support detoxification in the body as well. Essential oils. So if you are using these, you guys, in young children, so children, under a year, it's better to do like 1 or 2 drops of like lavender in a carrier oil, like 2 ounces of coconut carrier oil, versus trying to steam it or make like an inhalation, because young children can actually sometimes end up with a little bit of spasm in their throat from that kind of steam with all of those oils. So go ahead and just do it as like a massage to help with relaxation and promote the immune system to build. And then in older children, you could do a little bit of diffusing as well if you wanted, with lavender, eucalyptus, or peppermint to kind of help clear congestion if they're having a cold or cool the body. That can really be helpful. Nutrition. So sometimes, it's really easy to offer all kinds of different foods in an attempt to get kiddos to eat. And yes, sometimes we just want them to eat or drink something, right? So we're not getting too excited if they have a little taste of ice cream or something like that. But having said that, overall, it's better if you can just to go ahead and feed them something that's a little bit more nutrient dense so their body can fight off the infection. So something like a broth or a smoothie or like a light, easy digested meal, just something that's a little bit more nutritious. Obviously, you want to do something age appropriate. And if you have questions about starting solids, I do have another episode from Milk to Munching that is all about starting solids. So if you're not quite there yet, you can start with that episode if you would like. Homeopathics. So I do get a lot of questions on homeopathics just because of what I do, since I have an integrated practice. So first of all, what in the world is homeopathy? So it's just a medical system that uses a small amount, like tiny amounts of natural substance like plants or minerals. And the idea is that these like small dilutions, basically these small amounts of plants and minerals, stimulate the body's healing process. So it's based on this principle of like cures like. And, people that are homeopaths will treat with like these highly diluted substances that would cause similar symptoms in a healthy person. And this was developed in Germany in 1700-ish sometime. And a lot of people in Europe, use homeopathy all the time, but it's a little less common in the US. There's a little controversy about it. In the conventional medical world, it's considered safe because the dilutions are very small, or, it's these tiny little doses. However, how effective it is, it hasn't been proven by science to be, extremely effective. just from what people tell me, sometimes it seems to work, sometimes it doesn't. But I want to offer these different options in case it's something you're interested in trying. So, some of the homeopathy treatments that I would think about using, one would be chamomile. So, chamomilla, I think is the correct way to say that. And it'll come in different like concentrations. So like 6C, 12C, or 30C, all of that's fine. And you would use it if your kiddo has a fever, but they're also like irritable and thirsty and they want to be held and they're impatient and they're just kind of cranky. Then this is a really good one to use. Ferrum phosphoricum. That's a great one, especially if there's any ear complaints. I find it really helps with ear infections. So, if you've got a fever with like ear stuff and kind of cold symptoms, flushed cheeks, then you could use that. And the concentration would be 6, 12, or 30C. Nux vomica. So if your kiddo has a fever plus digestive stuff, like they've got like upset tummy or maybe they vomited, you could use Nux vomica. That's hard to spit out. You would use a 30C or 200C for that. This is another one that I really like for flu season. So if your kiddo has like flu-like symptoms like achy, chills, super runny nose, headache, one that's really good for that is oscillococcinum. And if I said that wrong, I am sorry to the people that invented it. I'm still working on it. There's a brand name that I like much better. But anyway, oscillococcinum. And you would give 200K at the first sign of illness. And there are plenty of brands out there, like Boiron is a big one that people use. And that's even on, if you want to sign up to my full script, you can get it there as well and get a discount. Okay, what else? Oh, pulsatilla or pulsatilla. That's if your kid has a fever plus like really thick cold symptoms like a thick yellow nasal discharge or something like that. This can really help with that. And that dose would be 30 or 200C. So a lot of people are like, well, how do I even like dose this or like give it to my kids? So if your child is not old enough to eat the little sugar pellets, which really I don't recommend feeding a child a pellet under 5 or 6 years old because it's just a choking hazard. That being the case, if it's a younger child, go ahead and dissolve those pellets in, a teaspoon of water. And you're just waiting for the outer coating to kind of dissolve. So you don't feel like you need to wait there like 15 minutes for the whole pellet to dissolve because the inside part of the pellet is just kind of sugar stuff. And so you don't really need that or want that anyway. Wait for it to kind of dissolve though on the outer coating and then go ahead and give like 1 ml of the liquid. And then you'll wait about 30 minutes and see if there's any improvement. And then if there's no improvement, then you can just go ahead and give it like 3 or 4 times a day. So like, how do you know if it's working? So if the symptoms get better. So, if their fever goes down or like maybe they're in a better mood or they're sleeping a little better or, they're just a little less cranky and they're more able to tolerate things, then you know that it's helping and it's working. And by the way, you can combine all these treatments with like other therapies. So like if you're doing something herbal or, acupressure, acupuncture, or even like a fever reducer, you can definitely do those all together. And hydrotherapy, of course, too. So like any of those water treatments that we talked about earlier, you can combine all that together. For infants, I wanted to say one thing about special considerations. You want to avoid something like an undiluted belladonna. So belladonna is poisonous when it's not extremely dilute. I just avoid it in newborns and infants because God forbid, that something could happen. And then again, like, of course, avoid giving your baby a pellet because of the choking hazard. I get a lot of questions about like, is it safe for babies or is it safe for breastfeeding moms? It is considered, as long as you're using like a reputable brand and like a proper potency, it is considered safe for both of those situations. But just make sure, like check with your holistic pediatrician about all of that. Conventional treatments. Okay, so when should I or should I not use a fever reducer? So we're talking about like acetaminophen or ibuprofen. Brand names of acetaminophen would be like Tylenol, and brand names of ibuprofen would be Motrin or Advil, something like that. Those are kind of the most common. Of course, there's like other brands out there like Genexa, which has a little plug for Genexa, which is a little bit cleaner when it comes to that acetaminophen. So There's a lot of range out there. So go ahead and treat a fever. If your kiddo, you've done all of those other things, you've put them in a bath and you've put the wet socks on and you've let them air out and they're still just so uncomfortable. They're not able to rest. They won't drink. They just look really punky. That may be a time that you want to go ahead and treat the fever. Again, though, if your kiddo is under 3 months old and you really don't know why they have a fever, really important to go ahead and seek help. Ibuprofen. How does it differ from acetaminophen? So it reduces both fever and inflammation, first of all. It lasts about 6 to 8 hours. We do want to avoid it, you guys, in kiddos under 6 months. So if your kiddo is 6 months or younger, please don't do ibuprofen because it affects their kidneys a little bit too much. And then Tylenol, that lasts about 4 to 6 hours. It's a little gentler on the stomach. However, in the functional medicine world, we're a little bit worried about how it can deplete glutathione from the liver and cause issues that way if you're overusing it. So obviously you don't want to overuse it. But then if you are having to use it because of some kind of situation where your kid is just so sick that they need it, then on the back end, we can use things like vitamin C antioxidants or glutathione or zinc to kind of replete the body and replete all those levels. So definitely chat with your holistic doctor about that one if you are using Tylenol. So key takeaways, you guys. So fevers are natural. They're often a healthy part of the immune response. Just make sure you're watching out for warning signs, but don't panic. Like with every elevated temperature, again, 3 months and under, a different story. But in general, it's not something that you have to run to the emergency room for. But you do want to support the body holistically. So the rest, hydration, comfort measures, hydrotherapy, lavender essential oils, the wet sock treatment, all of those, holistic treatments. If you want to use homeopathy, or you can try that as well. And then when it comes to conventional treatments, if your kid's happy, they have a low grade temperature, but they seem kind of fine, I'd be inclined to just let that fever run its course, do its job, burn off whatever infection is going on. No need to medicate. However, that being said, if they're just miserable and they can't maintain, then you do want to go ahead and most likely treat that and then just treat side effects on the back end. So again, like that glutathione or zinc or vitamin C. Something else I just want to touch on is parental intuition. Parents are absolutely fabulous at knowing when something's just not right or something's off with their kiddo. And although, a parent may not have a medical background, just that listening to that intuition can be really helpful. So if you feel like in your gut something is not right, by all means, just go in and seek care and just find out what's going on, because it's always just better, to be safe than sorry. All right, guys. Well, I hope this topic was helpful to you and told you something a little bit about fever. I just want to invite y'all to just share your own tips and experiences. And by the way, you're all doing a great job. So if I haven't said it before to all my parents listening out there, good job. You got this. You are doing amazing. I know that you are. If you're listening to this podcast, you're getting information for your kiddos. And I'm sure there's a whole host of other things you're listening to and reading that is just making you the most amazing parent. So keep it up, you guys. Keep it up. Okay, well, we're going to have other episodes coming up. Hopefully one on a cold, hopefully one on rashes. I think we may have some guests coming on. So please subscribe, leave a review, share, share with your friends. I would much appreciate it. And again, my name is Dr. Ellie. I'm with Middle Path. I'm the founder of Middle Path Integrative Pediatrics in Asheville, North Carolina. And I am wishing you all guys well. Okay, bye guys.